So what should you expect after lens replacement? Well, within a few days the vision will be good. And with our multifocal lenses, what's extraordinary to me is how quickly patients learn to use the different points of focus, the distance, intermediate and near. It's a new way of seeing. In our 20s and 30s, what we're doing is moving focus from distance through to near seamlessly. What we're using with multifocal lens technology is simultaneous presentation of these different images, and then your brain will shift attention from one image to the other depending on what it is you want to look at. You haven't done this before, and yet what's amazing is we put these lenses in and within hours sometimes you will start using these different points of focus really effectively. But like so many things in life, it'll improve with time. So the eye itself will be settling down in those first few weeks, even months. The last little bits of inflammation, a little bit of dryness will settle away. But your visual system, your brain, will become better and better at using the multifocal lens. When we see, it is not cinema projection. We create our view of the world. 2/3 of our brain is involved in processing visual information and creating this world view. And when you have a multifocal lens implant in both eyes, you're going to carry on learning and improving over about a 6-month to 12-month period. And that's an average. And I've met patients who it's taken a couple of years, and after that they've said, do you know what, James, it's absolutely amazing now. It's better than it was a year ago. And their eyes look the same, the prescription hasn't altered. The only explanation can be that they have become better at using the technology. Conversely, there are some patients where I put these lenses in and it was as if they were born to have them, and within a week everything's perfect, everything's wonderful. I'll give an example of something that might improve. So quite commonly patients will see little rings around car headlights when driving at night time. Initially this is a new optical effect and their eyes and their attention are drawn to it, and it's really quite noticeable. As their eyes settle down and the inflammation goes and the dryness improves, actually the halos do become less. But then they become subjectively less aware of these halo effects purely as a learning effect. The brain is suppressing the halos and improving the quality of vision of that patient. It's incredible, it's a learning effect of the brain. For some patients, after the initial lens replacement procedure, I need to do a little bit more work for them, typically about 3 to 6 months after the original surgery. So the lens replacement procedure will work extraordinarily well, providing we achieve that nice sharp distance focus. Most of the time, the measurements that I've taken at Custom Vision Clinic with all of the equipment which we have there is sufficient to achieve that outcome. In fact, it almost looks too easy. We take the measurements, 10-minute operation, and we're home and dry. But for about 4% of patients, the measurement is good, but it's just off very slightly. And I want my patients to be delighted with the outcome. So if we're off by even 3/4 of a diopter, it may just affect the performance slightly. Thankfully, I have access to very, very accurate laser technology, laser eye surgery technology, and I can use corneal laser eye surgery to enhance the outcome, to fine tune it, and then it will deliver. So that's all part of the package, that's all part of looking after patients from start to finish. And it's part of ensuring that we make sure that every single patient achieves the very best that they can and really gets an excellent visual outcome and an improvement in their quality of life.